An example of a time when physician-assisted suicide would be used is when a person or an infant with the condition of spina bifida, which is when the spine and the spinal cord are not fully formed, permanently paralyzes the child from the waist down. They will lack bladder or bowel control. In other cases, intellectual disabilities will develop due to excess fluid accumulating in the brain. For these sufferers to be kept alive, they must have major surgery, often sometimes 40 times between the individual until they reach like adolescent years. This, of course, is even if the infant survives. In this case, euthanasia should be used. My opponent stated that God owns you and that, therefore, you shouldn't decide, a person shouldn't decide when they should pass away. This is a religious superstition. The concept of separation church and state should protect non-Christians from Christians, trying to force religion down terminally ill throats. Christians have no objection to painful or desperate measures to prolong life unnaturally. Surely this is just as much inference with God's time. For instance, Christian fundamentalists, for instance, I'm sure this has surgery with anesthesia and go to the dentist when they have a toothache. This is escaping from some type of suffering, so where do you draw the line? A nurse wrote from a hospital that, this is what she said, I support euthanasia, but I do so only on account that I have heard the screams of the suffering. I have felt the trembling hands of those in agony. I have seen things that have turned a savage to cured. This world has envisioned many cruelties and all sorts of manifestations. When a person is forced to live their life, their face ablaze with all the signs of pain, tears, panting, and when they must live their life like this, day after day, week after week, month after month, nothing but pain and then more pain. What is this, existence? Is it life with dignity? This goes to show that she has seen terminally ill persons go through much pain, and therefore she is for euthanasia or physician-assisted suicide. Also, while talking about nurses, a survey was conducted in a hospital. Dr. Ash found that 17% of nurses reported that they have received requests from patients or family members to perform euthanasia. 11% had granted a request to perform euthanasia or assist in suicide, and 4% has had a patient's death by only pretending to provide life-sustaining treatment ordered by a physician. In conclusion, with the proposition we have given, euthanasia should be legalized in California to terminally ill patients.